January is National Thyroid Awareness Month. Your thyroid is a small butterfly-shaped gland at the base of your neck, and it can be affected by hormones. One doctor is noticing many people overlooking this disease and the impact it has on other parts of the body.
So joining us live to talk about it is oculoplastic surgeon Dr. Mirwat Sami and her patient Ismar Monroy, who discovered that she had the disease. Good morning, guys.
Good morning. Good morning. Thank you for having us.
Dr. Sami, tell us about thyroid eye disease before we ask Ms. Monroy how she was diagnosed.
So thyroid eye disease is an inflammatory condition that affects all the connective tissues around the eyes. So the muscles, the fat, it causes swelling and inflammation. And it is an autoimmune condition. And what that means is that our body's immune system is attacking itself. And in this particular condition, the antibodies that are created will attack the muscles, the fat, everything within the eye socket or the orbit, and cause the eyes to start bulging out. Also causes double vision, severe dry eyes, pain, swelling, and then also when the eyes start bulging out, that causes a lot of aesthetic concerns, a lot of issues. And Ismar will tell you more about her journey. And just like with any medical condition, it's on a spectrum. There are some people in whom it is rapidly progressive and worsening really fast. And in others, it could be something that, they kind of know that something's changing in their eyes and in their faces, but they can't pinpoint it until they go to a specialist, have all the testing done, and really discover that.
Yeah, a lot of concern here. I'm sure this is very scary for these patients. Doctor, how do you treat thyroid eye disease?
So because it is an autoimmune condition and we don't have any immunomodulators that will just targetedly affect and neutralize that antibody, we end up having to suppress the immune system globally. We have some better medications now. Tepezza has been revolutionary for our patients, but prior to Tepezza, it would be things like steroids, radiation, chemotherapeutic agents. And then when those are not working, or if someone is rapidly progressing to where their optic nerve is being compressed, then surgeons like myself, oculoplastic surgeons, perform surgeries such as orbital decompressions and retraction release, muscle repair. So those are the kind of procedures that we end up having to do in order to treat this condition.
Yeah, and Ismar, can you tell us about your diagnosis and treatment?
I actually found out back in 2019. I actually had a doctor's appointment for my eye inside. I went to the ophthalmologist, and he was the first doctor who mentioned to me about having thyroid condition. I wasn't aware of it until he said, I recommend you seeing your internal medicine doctor for that. And that's when my journey actually started, doing blood work and everything. And that's when I got confirmed that I had a thyroid condition.
What's your vision like right now?
Like Dr. Sami mentioned, dryness, my dryness. I had dryness eyes before, but now it's gotten a little bit worse when it comes to, my dry eyes. I have to use eye drops once in a while to keep them hydrated. But double vision, it hasn't got to that point yet. Right now, basically, my thyroid condition has been on remission for the past 4 or 5 years now.
Wow, that's amazing.
I don't have to take no medication for it. I've just been basically following up with my specialist every 3 to 6 months, just running labs and making sure everything's stable. But as of right now, everything's been good.
What a relief. That's amazing to hear. Yeah. Doctor, tell us why this disease impacts more women than men.
Yes, it definitely does. It is a lot more common in women and than men, and it also occurs more in that 30s and 40s range, age range. We know that risk factors associated with thyroid eye disease include like your family history, genetics plays a huge role. And then also, because the thyroid hormone, think of it as one of the thermostats of your body. So it sets the pace for your attention span, your energy levels, your pulse, your blood pressure, your heat or cold intolerance. So it really is the thermostat for your entire body. So in more ways than one, patients, when they're that age and they start experiencing thyroid hormone dysfunction, it is a little bit of a journey to discover, if it is a thyroid hormone issue or just the sort of like an age-related process or another hormone that could be out of whack. But certainly when thyroid hormone dysfunction occurs and someone presents with a thyroid eye disease, we definitely see that more in women than in men.
Okay, so the take-home message is to be on the lookout for something like this. If you have low energy, if you are experiencing vision problems, and obviously you can go to an eye doctor. You can talk to your PCP. They can do blood work and find this. And then obviously Dr. Sammy has the solution for how to treat it. Thank you guys so much for joining us this morning. We appreciate your time.